Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. I just wanted to talk to everybody today about the pelvic floor and why the pelvic floor is absolutely vital to treat if you ever want to have a chance of maximally regulating the nervous system of your patient. So the overall goal of all physical therapy treatment, in my opinion at least, should be to regulate the autonomic nervous system towards homeostasis as much as we can, right? So one of the things that happens to human beings, so remember, all humans, the typical reaction of human beings to any type of mental or physical stress, strain, pain, or trauma is sympathetic autonomic nervous system hyperactivity, right? That's just the way it is. So we can basically assume that basically all physical therapy patients and most medical patients in general are presenting to their doctor or clinician with sympathetic autonomic hyperactivity. It's just what happens when the human body gets aggravated, both mentally and physically, right? So one of the things that is really, really important about the autonomic nervous system, especially the sympathetic part, is that where my two fingers are here, that is where the sympathetic chain goes down, right? So the sympathetic chain, aside from the brain, is basically the sympathetic portion of our autonomic nervous system. So here's at C7T1, which is right about here, right? There's a ganglion, right? So my finger is going to be the first rib. There's going to be a little ganglion here right in front of the first rib called the stellate ganglion or the star ganglion. That's typically considered to be the top portion of the sympathetic autonomic nervous system. And then that chain goes down the anterior lateral portion of the vertebral bodies, and it goes all the way down to the lumbar spine and into the pelvis, and it follows the inside of the sacrum, and it goes all the way down to the coccyx. So in most books, the sympathetic chain is considered to be from the stellate ganglion to somewhere in the lumbar spine. And then the parasympathetic portions of that chain and the spinal column are the upper cervical spine, so like C012, and the sacral plexus, S2 to S4. And remember, the sacral plexus, being a parasympathetic dominant portion of the autonomic nervous system, innervates all 9 true pelvic floor muscles to some degree or other. So those are the 9 most parasympathetic dominant muscles in our body. And because they're the most parasympathetic dominant, they're going to be the most reciprocally inhibited by chronic sympathetic hyperactivity, which basically all of our patients present with, right? So let's take a quick look at the sympathetic chain just so everybody can get a better visualization of it, and then we'll come back and we'll talk about why treating the pelvic floor is so important if you ever want to have a chance of maximally normalizing the autonomic nervous system. And that is important, and you cannot get your patients to reach their full potential if you don't maximally regulate the autonomic nervous system. All right, everybody. So here is what I was just talking about in the video, right? So this entire nervous bundle, starting up here, going down there, there's the stellate ganglion, right? So there's the star ganglion right there. There's some information about it if you want to read about it. So this is what I was talking about. So this is typically considered, aside from the brain, the top of the sympathetic autonomic nervous system. And this stellate ganglion can give the upper extremity unusual radicular symptoms, stress on the sympathetic chain, anywhere from here up to the head all the way down to the coccyx can put stress on this ganglion that can cause brain fog and cause all sorts of sympathetic hyperactive problems, hormone disruption. I mentioned here's the middle scalene, right? So if that gets tight and deviates C1 and or C2, that's going to put stress on the stellate ganglion and the rest of the sympathetic chain. And then if you follow the sympathetic chain down, this is the entire sympathetic chain, right? So it goes from the stellate ganglion right there, right? And then if we follow it down, it goes all the way down towards the lumbar spine, and then it continues on down through the pelvic area and all the way down into the pelvic floor, right? So this is just an extension of that same chain. So this is what I was talking about, you guys. If the spine gets deviated anywhere, deviated enough, including the pelvis, it's going to put tension, abnormal stresses, and strain on that sympathetic chain. And then again, see how the psoas major, look at, there's tendrils of that sympathetic chain that go directly through the psoas major, and they also continue around the backside into the multifidus. So if we just zoom in here a little bit, look, there's tendrils of that chain. There's the multifidus. So the multifidus and the psoas major are basically touching each other, and they both have direct tendrils of that sympathetic chain going through them. So the psoas major is obviously in the pelvis and lumbar spine. If we zoom out, the multifidus goes from C2 all the way down to S2, and then the sympathetic chain is right on the opposite side of the vertebrae from the multifidus. So if the multifidus gets tight, pulls the spine out of orientation, deviates the ribs can directly push on the sympathetic chain if they get displaced. That elevates sympathetic autonomic nervous system activity and causes widespread dysfunction of the nervous system. So again, just because the pelvic floor may not be an area of complaint for somebody, it's vitally important to treat, because if you don't treat the pelvic floor, you're missing a huge percentage of the autonomic nervous system regulation that you could induce with your patient. All right, guys, so now that we took a look at the sympathetic chain, you have a better idea of what we're talking about here. So the pelvic floor muscles, the reason that treating the pelvic floor is so important for all other conditions in the human body is that the pelvic floor is the base of our core, right? So everybody learns about how, core muscle activation is important. Having a good, strong core muscle is important. And then people just totally forget about the pelvic floor, which is the bottom part of our core, right? So aside from the mechanical factors of it being so important for the pelvic floor muscles to be able to contract and relax properly. Now, notice that I don't say it's important for the pelvic floor muscles to be super duper strong, because people's pelvic floor muscles are strong enough. The problem that people have with their pelvic floor muscles is because they're so parasympathetic dominant. When the sympathetic autonomic nervous system goes up, it reciprocally inhibits the parasympathetics, right? So when the parasympathetics reciprocally get inhibited, that's going to shut down blood flow and innervation, muscle firing patterns to the pelvic floor muscles, more so than any other group of muscles in the body, because they are all innervated by some degree of S2 to S4, which is parasympathetic dominant. So again, remember, the autonomic nervous system is like a seesaw. The more the parasympathetics go up, the more the sympathetics go up, the more the parasympathetics get inhibited. When the parasympathetic muscles get inhibited, they become hypoxic. They get filled with pro-inflammatory markers like interleukin-1, interleukin-6, tumor necrosis factor alpha, right? Certain anti-inflammatory pathways inside the cells. There's a mitochondrial pathway called the NRF2 pathway, which gets shut off with chronic sympathetic hyperactivity. So our mitochondria lose the ability to clean up the cells as much. Remember, they're more or less the powerhouse of our cells. They provide all the energy to everything, right? And then also, when the sympathetics get hyperactive, our aerobic respiration, the citric acid cycle, that starts producing less ATPs. So the body starts to run out of energy, and it becomes energy deficient when the sympathetics are too hyperactive, right? So as far as treating the pelvic floor goes, there's a whole bunch of reasons why it's so important to treat the pelvic floor with all your patients, right? So number one, we just briefly talked about the structural aspect, that the pelvic floor is at the bottom of your core, so it's very important mechanically. Neurologically speaking, treating the pelvic floor muscles stimulates the parasympathetic autonomic nervous system, which reciprocally inhibits the sympathetics, which is super important if we ever want to achieve our patient's maximum potential, right? So the way that I look at treating people is you want to treat the nervous system itself, because theoretically, if you put a human being's nervous system into homeostasis for long enough and avoided life in general, like any other aggravating things, theoretically, the body would heal itself, right? The problem is that life gets in the way and other stuff gets in the way. So if we can specifically target the autonomic nervous system and try to regulate that as much as we can, the body knows how to heal itself. It's just that it gets inhibited from doing so. And one of the big reasons is with enough sympathetic autonomic hyperactivity, our body loses the ability to self-regulate, and it can never achieve that level of homeostasis where it can start to utilize the proper amount of energy for different things, right? So our body only has a finite amount of energy. Once you run out of all the energy that your body has available, it has to start making hard decisions, and it has to decide where it's going to put energy and where it's going to limit energy, right? So the areas that get most negatively affected with sympathetic hyperactivity are the parasympathetic areas. So again, pelvic floor, upper cervical, jaw, those areas, right? So if our body is in an energy crisis, this is one of the things that leads to cancer, autoimmune diseases, and all sorts of stuff, right? So if we can put energy back into the body or back into the battery or put gas back into the generator, however you want to think about it, the more tissue pathology that we remove from the body and the more spinal neutrality that we can induce through joint manipulation, all of that is taking stress off the sympathetic autonomic nervous system, both almost directly and indirectly, right? So by removing tissue pathology, you're removing energy that your brain needs to use to focus on healing that tissue, right? And then if you have serious, let's just say you have a really deviated lumbar, like that would be like almost broken, but yeah, so like that, if you had a broken lumbar spine, right, or if it was significantly deviated, like this segment right here, think about what that's doing, right? So if we rotate it way out of neutral, that is going to put direct pressure on that sympathetic chain here, right? So if that sympathetic chain starts getting pulled and pushed on in different orientations, what's going to happen is it's going to indirectly pull that entire chain. It's like putting knots in a rope, right? Just think about a rope going from your coccyx all the way up to your brain. You start tying knots in that rope starts to get shorter, it starts to get compressed, and that is the sympathetic autonomic nervous system that we can directly affect in the body, the one that's right on the vertebral column, because we can normalize muscle tissue and normalize joints to take direct stress and strain off the sympathetic autonomic nervous system. So again, if you have a lot of pelvic pathology and your pelvic muscles are short and tight and stuck, that's going to inhibit movement of the pelvis and of the sacrum and of the coccyx, and it's going to put tension and stress on that sympathetic chain down here. One of the muscles that really does it, and it's the muscle that can most directly pull on the sympathetic chain. So the psoas major is kind of like my hand, right? And it goes down like my forearm. So the psoas major sits almost directly on the lumbar portion of the sympathetic chain, and the sympathetic chain has little tendrils that go directly through the psoas major, and then the multifidus, which is where my fingers are at in the lamina of the spine, that's the other closest muscle on the posterior aspect of the sympathetic chain, and that covers the whole spine from C2 all the way down to like S2, right? So as far as muscles in close proximity to the sympathetic chain itself, it would be the psoas major and the multifidus, right? And talking about pelvic floor dysfunction, the psoas major starts on the anterior lateral portion of the vertebral bodies, right? Goes down on the inside of the ilium, attaches on the lesser trochanter, right? So that muscle, when it's tight, in my opinion, is the worst lumbar and hip joint compressor because it removes long axis distraction from the hip joint. So remember, the best ways to overall mobilize a joint are to improve the joint capsule mobility and distraction, both lateral and long axis if possible. So for the hip, I think the two worst overall compressors of the hip are the psoas major, because that removes long axis distraction, and then the obturator internus, which is kind of like my hand. It goes from the greater trochanter around the ischial tube, and then it takes a 90-degree turn and it attaches on the inside through the obturator foramen there. So the obturator internus removes lateral distraction, the psoas major removes long axis distraction, and it just crushes the hip joint together, right? So there's muscles that can directly pull on the sympathetic chain, the psoas and the multifidus most primarily, also pelvic floor muscles, because the sympathetic chain goes right down here near the levator ani complex, right? So if your deep gluteal muscles get tight, that can also directly pull on the sympathetic chain and cause sympathetic autonomic hyperactivity, which may not present in the pelvic floor. You could be having pelvic floor problems that are causing upper cervical problems. And this is why I say it's so important to treat the pelvic floor. So let's just think about this for a second, right? If you have pathologic pelvic floor muscles, number one, that's going to aggravate your nervous system to no end. It's going to shut down your parasympathetics, it's going to stimulate your sympathetics, and you're going to have tight, hypoxic, short, weakling, useless muscles in the pelvic floor, right? If the pelvic floor muscles get tight, they're going to deviate the pelvis. One of the problems with the pelvic floor muscles is they're short muscles that attach in between bones that don't typically move a whole lot, right? So if the right ilium gets anteriorly rotated, one of the things that happens is the internal aspect of the PSIS, right? If my thumb is that PSIS, as that starts to go forwards and it rotates forwards, because that's the most common deviation of the pelvis, right? Remember, the ilium can rotate externally and it can rotate posteriorly, but it's just hard for it to do that because it wedges into the SI joint. So it's much more common for the ilium to get deviated anteriorly and or medially. So if it gets deviated too far anteriorly, what happens is my thumb here, if it's inside of the PSIS, it pushes on the posterior aspect of the right transverse process of L5, and then that causes a left rotation of the lumbar vertebrae, right? So a big enough right anterior rotation of the right ilium will push the right L5 transverse process, and it'll cause left rotation of the lumbar spine. Right? If that causes left rotation of the lumbar spine, remember the normal spinal mechanics for the lumbar spine are rotation and side bending to the opposite side. So if you're pushing the lumbar spine into left rotation, it's also going to go into right side bending, which is going to cause the thoracic spine, which has the same mechanical movements, side bending and rotation to opposite sides. That's also going to cause the thoracic spine to go into left rotation and right side bending, right? So the problem with this is if you start with a significant enough deviation in the pelvic area or the low lumbar spine, that is going to lead to a significant upper cervical deviation. So why is that? So C1, 2, so here's C2 right here, right? So C2 has 50% of all cervical rotation. So if I have 90 degrees of left cervical rotation, 45 of those degrees are coming from C1, 2 rotating, right? So C1, 2 has about 40 to 45 degrees of rotation. The next most rotation in the whole spine is also in the cervical spine, and it's only like 13 degrees. And then when you get down into the thoracic and the lumbar spine, it's like 5 degrees or less of rotation per segment, right? So let's just say we have a bunch of small rotational deviations in the lumbar and thoracic spine. Well, the easiest place for the body to compensate for that, and this is just how physics and mechanics work, right? The easiest place in the structure for it to compensate is the most mobile segment that rotates the most. So if you have left rotation of the lumbar spine and the thoracic spine with concomitant right side bending, right, then you're going to have a corresponding right rotation of C2 and possibly left side bending of C3 to C7, because that's the most mobile part of our spine, C1, 2 specifically, and the cervical spine in general. So C1, 2 is the segment of the spine that is the easiest to compensate for deviation anywhere else in the spine. Well, what's the problem with this? At C2, in the dorsal horn of the spinal column, there's a nucleus called the trigeminocervical nucleus, right? And the trigeminocervical nucleus at C2 is the very bottom section of the trigeminocervical complex, which goes from the trigeminocervical nucleus at C2 up into the brain and up into the neocortex, right? And one of the connecting areas in the trigeminocervical complex is the locus ceruleus in the old brain, right, in the brainstem, and that's right near the thalamus and the hypothalamus, which is part of the hypothalamic pituitary adrenal axis, which is one of the main autonomic nervous system axes, which controls our hormone release, production, and all that stuff. So the trigeminocervical complex gets almost directly aggravated by having C2 deviation, because C2 is mechanically right at the trigeminal cervical nucleus, the bottom part of the trigeminal cervical complex. And one of the things that researchers are thinking right now, at least, is that we can see that the afferent nerves coming from the true suboccipital muscles, 2 out of the 4 true suboccipitals attach on C2, right? The multifidus attaches on C2, and the middle scalene attaches C2 to the first rib, and that's a really problematic muscle, right? So if C2 gets off, the suboccipital muscles attaching there get aggravated. Researchers think that with enough negative afferent signals going to the brain from C2 area, those afferent nerves, like all nerves, cross over the spinal column right on top of that dorsal, right on top of the trigeminal cervical nucleus, and we think that somehow enough negative electrical activity going through those wires or through those nerves translates to the trigeminal cervical nucleus and it short circuits it somehow. That's one of the primary reasons we think that people get cervicogenic dizziness, or like inner ear type problems coming from the cervical spine, which is actually much more common than dizziness coming from the ears themselves. Cervicogenic dizziness is hugely underdiagnosed. I think most medical doctors don't even know that it's possible, but it is without question by far a bigger dizziness and headache problem causer than the brain itself or than the ears are, right? So again, that is just one very, very common, easy way that pelvic floor pathology very quickly leads to upper cervical pathology, which directly negatively affects brain systems, right? So now we have pelvic floor dysfunction, pelvic dysfunction, and upper cervical dysfunction. Those are the 2 primary parasympathetic dominant areas of the body, so that's going to lead to further sympathetic autonomic hyperactivity, more depression of the parasympathetic autonomic nervous system, more disruption in our hormone production. It's going to limit the amount of endogenous opioids that we produce. We're going to start producing more sympathetic neurotransmitters, right? So I mentioned the locus ceruleus is part of the trigeminal cervical complex. That's the brain's primary epinephrine producer, right? So epinephrine is the major sympathetic nervous neuromodulator. So more epinephrine is produced, the more anxiety we get, the more our muscles get tight, and it just turns into a big negative feedback or a detrimental feedback loop where the muscles are aggravated, the joints are aggravated, the nervous system is aggravated, and all of those things further aggravate each other, and it just becomes this big problem in the nervous system unless a specific intervention is done to normalize the pelvic floor muscles, right, which can cause all of this other stuff. And again, this is the tricky part about the pelvic floor, is a lot of the time people won't complain about the pelvic floor, but they'll complain about all these other neurologic problems. And a lot of the time, one of the underlying root causes of that neuropathology is coming from the pelvic floor, even though the patient may not be aware of it, right? So there's a whole bunch of good reasons to treat the pelvic floor. This was just one of them. I'll make a couple more videos like this, you guys, talking about different ways that pelvic pathology can lead to other pathology throughout the body. But just remember, the sympathetic chain is directly connected to the pelvic floor. If anything happens to the joints or the musculature down here, that is going to very, very quickly start to aggravate muscles and joints and structures farther up the chain and into the brain, right? So nothing in our body happens without the brain telling it to. So all of the treatment that we're doing should be primarily focused on how can we treat the body to directly change the brain, right? That is the best way to get to autonomic nervous system homeostasis and allow the mind and the body to use their really awesome innate healing abilities to the maximum extent. Again, it's not that they can't heal ourselves, it's that they're being inhibited from doing so. Thanks everybody. Let me know if you have any questions about anything, and keep an eye out for more videos and check out our blog page on intricateartseminars.com. Thanks.